Hey y'all. So, welcome to my channel. If you're new here, hit the like button if you're interested in my topics. And if you're returning, thank you. Make sure you hit the like button too. And the notification bell. Because I'm hoping that this cycle would work. I don't have any feeling about it, but I've been trying to do better and kind of doing better with just letting the cycle flow versus previous cycles just really thinking about it. But anyway, so I just wanted to come in and kind of give an update. My last video where it was the live pregnancy test and then my trip to the emergency room. And just to give them a little update on my heart situation, I did ended up wearing a monitor. It was just like a little strip that you put on your chest and had a button on it. So I would push the button anytime I felt like I needed to. I would push the button anytime I felt like I had any palpitations, any chest pains, or anything like that, shortness of breath. So he said that 75% of the times that I pushed the button, they noticed the palpitations. 25% of the time, they didn't see anything. So he just pretty much chalked it down to premature ventricular contractions, which basically is just one of my lower chambers throwing in an extra beat or just doing what it wants to do. They said it was normal. But I will probably say common, not normal, because like I said, I've never had these this much. Like, it's crazy how often they happen, and generally how they make me feel, or whatever I'm feeling is causing them. So I don't, at this point, I don't know. I can honestly kind of just really admit I think I've been having anxiety attacks, and that could be the issue. But just how they started, I don't know. The whole situation with that Saturday while I was driving, like, I was really just not really stressed about nothing, not thinking about nothing. No, I don't think I was. I was, I was kind of okay, but I was just singing and driving along. But anyway, yeah, that was that. So um I was scheduled to get an echo, but I canceled it just because I didn't want to deal with the bill, because I've already paid so much this year with the surgery that I still owe on that, and then just the doctor visits every month, and just, I didn't want to deal with that. And then once I did send my monitor in, everything kind of died down. Like, I stopped having them for a couple of days, and then they sort of picked back up. They've been pretty persistent the last maybe week or so. But I've been trying to keep myself in high spirits and good mood to see if it's more of my anxiety. But I notice when I get anxious or tired or something, like, especially when I'm tired, like if I'm at the gym or if I'm working out or moving around a lot, I have them. But I do notice them when I get sometimes, not really, but like I get lightheaded and like spaced out when I'm anxious. But anyway, this is not what this stuff is about. But I just wanted to update you guys in case you were wondering. So I'm okay. But and I will get the echo because he said he still wants me to get it. And like I said, they picked back up, so I do plan to go ahead and get the echo, and I'm gonna call probably one day this week and get it scheduled. But anyway, so I wanted to also update you guys on what's been going on with the TCCs. So I had an appointment August the 24th. That was to check my follicles, which was cycle day 12. I had 2 13s on my left. Let me verify that. Yes. I thought I would be ovulating from my left side this time, or just have my leading on my left this time, because my last time my right was the one that had the follicle, and the time before that it was the left. So, but I know nobody gonna do what you want to do. But I just, was going in on it, looking to see something on my left, because I was dreading. Y'all know, my left side, my left ovary is like hard to get to for some reason, and it hurts when they try to get their probe over there. So I knew, I was like, okay, I should be ovulating from my left side, and I'm like, I got to get ready for this pain. So that's more so what I was trying to prepare myself for. So, but when she got in, I noticed some good sizes on my right, because that's what she checks first. And so, yeah, I had two 13s on my left, and I had a 12 and a 13 on my right. With both sides, they still had some smaller ones, but of course they never count those, and there's nothing. So they told me to trigger on Friday, the 27th. They didn't give me any specific time, but just the trigger on Friday, and I should have been in the range of 18 to 21. Let's see, 13, 14, 15, 16. I'll even say like 16 to 21. If they grow about 1 to 2 millimeters a day, that'll put me in like 16 to 21. So, also, he did mention, he was like, I want to make you aware of, since you have so many follicles, good follicles as of right now, then you do have a chance of multiples. And basically he was like, if you don't want to, like, I think he was on the verge of saying that he kind of didn't want me to do the trigger. I think some clinics, like if you have like 5 or more, then they cancel. But he was giving me the option to say, well, there could be a chance of multiple. So if I didn't want to do the trigger, then I didn't have to, and just go with it, timed intercourse, or do the trigger still and risk that chance. And I'm assuming he said that because I usually only have like 2 good follicles. Well, 2 that they measure, 2 good follicles, and they usually on one side. I've never had like good sizes on both sides, and with all of them like right there together. So, and I know, that doesn't mean anything, but they have to tell you. And I mean, I'm kind of hoping for twins. I don't know about triplets, but I'll take it if my body will accommodate. But yeah, so I really love twins. Twins run in the family, so maybe that was one of the things, how it happens in our family, the hyperovulation. So maybe, this was one of those cycles I kind of, hyperovulated, from both sides, because, it does happen. But anyway, so I did the trigger on that Friday, and my husband did that for me. So yeah, so that's all the update I have for now. I guess I will see you guys. I already recorded my other video because I missed uploading this one. So I had to redo it. So I will probably upload this one today, and the update after this one probably Tuesday, so I can keep kind of current. I'm looking at my calendar. Y'all see me looking up. So I'm gonna try to stay current, and then by the time this week goes by, I'll have something to upload, and then I can upload again on Sunday. I'm trying to keep my uploads on Sundays, but I'll see. So yeah, so I'll see you guys in the next video.